Having access to the system and being able to use the system remotely has a huge benefit in lots of other ways, not just being able to document our visits and our findings instantly and having that accessible to other professionals. It also means that, for example, recently in the bad weather, in the snow, when we weren't able to physically visit patients could access our help remotely. We still had access, say, from home. For example, I worked from home on one of the snow days. We could still advise patients throughout the area known to the team from home and advise with up-to-date information, up-to-date medical records, up-to-date scans, drug lists. So I had the full information. It didn't matter geographically where I was. The same support and service was available, and that we can do 24 hours a day. So it's been a huge benefit and a bonus to patients directly as well. They get an instant service. As part of our daily work, it means that we can keep our notes and ledgers completely up to date as there and then. It means GPs, district nurses who also use the systems locally are up to speed and have the accurate information at all times as we've visited the patient. And there's no delay, and it's a timely service that we can offer patients and other health professionals locally.